Friends, today we will discuss revise Sono-FACTS in short. First, you should know about your machine. There are different type of knob present in every ultrasound machine. You should know where is the specific knob present in your ultrasound machine. Position of each knob is not specific. That means position of each knob is different in different company ultrasound machine. You should know where is your knob present in your ultrasound machine. As a beginner, you should use within 10 lakhs ultrasound machine. Higher the cost of ultrasound machine, higher the number of knobs. Before going to sono examination, you should know at least about 10 to 20 knobs which is present on ultrasound machine. Again I am telling position of each knob is not specific. That means position of each knob is different in different ultrasound machine. You should know where is the specific knob present in your ultrasound machine. The study of knob is called as a knobology. Within 10 lakhs cost ultrasound machine, 18 to 20 knobs are present. You should know only 18 to 20 knobs which is present in every ultrasound machine. That's why first you should know about the knobs, about the machine, then you go for sono examination. Without knowing about the knobs, without knowing about the machine, you should not go for sono examination of any organ or any part of the body. Ultrasound machine having two parts. One is screen or monitor, another is control panel. Control panel have keyboard and different types of knobs. There are three types of knob present in every ultrasound machine. One is rotating knob which come into function by rotation of the knob. Second one is sliding knob which come into function by sliding the knob. And third one is pressing knob which come into function by pressing the knob. Again I am telling there are three types of knob present in every ultrasound machine. One is rotating knob, another is pressing knob, another is sliding knob. I have already discussed about each knob in details in previous videos. Go and see the videos. In this video I will discuss it in very briefly. As I have already told, ultrasound machine having two parts. One is screen or monitor, another is control panel. Control panel have a keyboard and different type of knobs. Position of each knob is not specific. You should know where is the specific knob present in your ultrasound machine. First knob is power knob. It is otherwise called as a on or off button of a machine. It is present on left side top of a machine. By pressing it, the machine will be switch on, and again pressing it, the machine will be switch off. Second knob is new patient knob or new patient button. As name suggests, for adding a new patient, this button is used. Third knob is preset knob or preset button. By pressing it, you will go for gynecological or musculoskeletal or abdominal examination. Remember, by pressing the preset knob, you will go for gynecological or any part of examination. Fourth knob is multifunctional knob. As name suggests, it has multiple function. That means if you go from grayscale to color Doppler, its function changes automatically. Or if you go from color to power Doppler, its function changes automatically. These multifunctional knobs are present at the top of the control panel and its function is represented by the dialog box which is present just below the screen. That means this dialog box will represent what is the function of the knob at a particular point of time. Fifth knob is depth knob. For getting a good grayscale image, you should keep the depth as minimum as possible. Remember, again I am telling, for getting a good grayscale image, you should keep the depth as minimum as possible and the depth up to your area of interest. By keeping the depth as minimum as possible and up to your area of interest, good grayscale image will be produced. Depth is inversely proportional to resolution or quality of image. Depth also inversely proportional to frame rate. By decreasing the depth, increases the resolution or quality of image. By decreasing the depth, increases the frame rate. So, good quality of image will be produced. Another knob is frequency knob. Frequency knob is the first knob. After selection of the probe, you should adjust the frequency accordingly. If you are going to examine a obese patient, the frequency will be towards the lower side. If you are going to examine a thin patient, the frequency should be towards the higher side. That means frequency and penetration are inversely proportional. If frequency increases, the penetration will be decreases. If frequency decreases, penetration will be increases. Remember, frequency and penetration are inversely proportional, but frequency and resolution or quality of image is directly proportional. If frequency increases, the resolution and quality of image will increase. Another knob is gain or overall gain knob. It is a rotating knob. By rotating the knob towards the right side, brightness of the whole the screen will be increased, and rotating the knob toward the left side, brightness of whole the image will be decreased. That means it is used for increasing or decreasing the brightness of whole the image. It is not restricted to a particular point or particular area. Another knob is TGC knob or time gain compensation knob. There are 10 to 12 number of TGC knob are present. It is divided into 3 groups: upper group of TGC knob, lower group of TGC knob, middle group of TGC knob. Another knob is TGC knob or time gain compensation knob. There are 10 to 12 number of TGC knob are present. These are sliding knob. That means it come into function by sliding this knob. It is divided into 3 groups. That means upper TGC knobs, middle group of TGC knob, lower group of TGC knob. By sliding upper group of TGC knobs towards right side, there occur increased brightness of upper part of image. By sliding upper group of TGC knobs towards left side, there occur decreased brightness of upper part of image. By sliding middle group of TGC knob and lower group of TGC knob towards right side or towards left side, there occur increased brightness or decreased brightness of a specific area. Another knob is freeze knob. As name suggests, it is used to freeze a image. Set bottom knob and freeze knob are used for measuring a targeted area. Another knob is drag ball. It is called as a mouse of a computer. It is a multifunctional knob. It is used for size adjustment of color box and for move the color box here and there. Another knob is color Doppler knob or C knob. By pressing it, a color box will appear. By putting the color box on desired area, you can know the vascularity of the desired area. You can also know the direction of blood flow. Remember a mnemonic BART. B for blue, A for away from probe, R for red, T for towards the probe. Remember a mnemonic BART. Another knob is M mode knob or motion mode knob. By using this knob, you can calculate fetal heart rate. By pressing the knob, a indicator will appear. You should put the indicator on the fetal heart and you can calculate the fetal heart rate. Another knob is PW knob or pulse wave knob. By using this, you can take the pulse of a vessel. That means you can calculate the systolic velocity and diastolic velocity of blood flow. It is a pressing knob. By pressing the knob, a gate will appear. You should put the gate on the vessel. Then you will know the flow of a vessel or velocity of blood flow inside the vessel. Another knob is zoom knob. Always use zoom knob at the last. Don't use zoom at the first. First take a good grayscale image, then zoom on it. If you use zoom at the first, the quality of a image will decrease. So you use zoom at the last. Then another knob is measurement knob. By using freeze knob and set bottom knob, you can measure a targeted area. Remember, by using freeze knob and set bottom knob, you can measure a targeted area. Print knob is used for printing the image and save knob is used for save the image. Another knob is focal zone knob. It is one of the knob of multifunctional knob. Commonly it is the fifth knob of multifunctional knob which is present at the top of the control panel. It has two options, focal position and focal number. Keep the focal position on the targeted area. Keep the focal number as minimum as possible. By keeping focal position on the targeted area and focal number as minimum as possible, good quality of image will be produced. It is represented by a scale on the monitor having a pointer on it. By keeping multiple focal position and multiple focal number, less quality of image will be produced on the monitor. Remember, again I am telling, keep the focal position on the target area and keep focal number as minimum as possible. Now discuss about striking angle or angle of insonation. On grayscale, striking angle should be 90 degree. As the object is static on grayscale, the striking angle should be 90 degree. By keeping striking angle 90 degree, all beam are reflected from the object to the transducer. So good quality of image will be produced. By keeping the striking angle less than 90 degree or more than 90 degree, less amount of beam are reflected from the object to the transducer. So less quality of image will be produced. Remember, on grayscale, the striking angle should be 90 degree. By keeping striking angle 90 degree, all the beam are reflected from the object to the transducer. So good quality of image will be produced. Otherwise, keeping less than 90 degree or more than 90 degree striking angle on grayscale, less quality of image will be produced. Now discuss about striking angle or angle of insonation in case of color Doppler. Remember, base striking angle for color Doppler is less than 60 degree. As the target object is not static, that is dynamic, that is a moving object, that is blurred itself, the striking angle should be less than 60 degree. By keeping striking angle less than 60 degree, all the beam are reflected from the object to the transducer. So good quality of image will be produced. By keeping striking angle more than 60 degree, less quality of image will be produced as less beam are reflected from the object to the transducer. Remember, again I am telling, in case of grayscale, base striking angle is exactly 90 degree, but in case of color Doppler, base striking angle is less than 60 degree. In color Doppler, if you keep the striking angle exactly 90 degree, no color, no pulse, no wave will appear. In case of color Doppler, if you keep striking angle more than 90 degree, inverted image will appear, that is somersault image will be appear, that is reverse image will be appear. So base striking angle for color Doppler is less than 60 degree and our striking angle for color Doppler is exactly 90 degree. But in case of grayscale, base striking angle is exactly 90 degree. Remember, what do you mean by striking angle or angle of insonation? It is the angle between the ultrasound beam and targeted object. Remember, again I am telling, it is the angle between the ultrasound beam and targeted object. By using color Doppler, you can know the targeted object is vascular or avascular, and you can know the direction of the blood flow. It is away from probe or towards the probe. By using the mnemonic BART, you can know the vascularity of a targeted organ. B means blue in color, A means away from probe, R means red in color, T for towards the probe. Remember BART. Now discuss about near field and far field of an image. Whatever strike first by the beam is anterior or near field. Whatever strike last by the beam is posterior or far field. Remember, anterior field is near field and posterior field is far field. Let us discuss it with an example. In the image, probe marker is visible. The part of the image which is close to the probe marker is anterior part or near field, as it is strike first by the beam. The part of the image which is away from the probe marker is posterior part or far field, as it is strike last by the beam. Again I am telling, whatever strike first by the beam is near field, that is anterior part. Whatever strike last by the beam is posterior part, that is far field. Anterior part is known as near field and posterior part of the image is known as far field. Now discuss about probe marker or probe indicator. In every probe there is a probe marker present or probe indicator present, which is helpful for taking longitudinal section or transverse section of an organ. The probe marker or probe indicator is represented by a company logo or a elevation or a depression or a light or any type of marker by a company. In this probe, the marker or indicator is a elevation which is present at the narrow base of the probe. In this probe, the indicator or marker is a depression which is present against the narrow base of the probe. In this image, the probe marker is a elevation itself. In this image, the probe marker or indicator is a notch or a depression which is present at handle. In the image, probe marker is a elevation which is present on narrow base. In this image, probe marker is a elevation which is present on narrow base. In the image, probe marker is a elevation which is present on narrow base. In the image, probe marker is a depression which is present on narrow base. Now discuss about probe orientation. That means where and how to put the probe during taking longitudinal and transverse section of an organ. For taking transverse section of an organ, you should keep the probe marker or probe indicator towards right side of the body. And for taking longitudinal section of an organ, you should keep probe marker or probe indicator towards patient head. Again I am telling, for taking transverse section of an organ, you should keep probe marker towards right side of the body. And for taking longitudinal section of an organ, you should keep probe marker or probe indicator towards patient head. Let's do with an example. The slide shows the sonologist taking transverse section of an organ as the indicator is towards right side of the body. This slide shows the sonologist is taking longitudinal section of an organ as the probe marker is towards patient head. This slide shows the sonologist is taking transverse section of an organ as the probe marker is towards right side of the body. Again I am telling, for taking longitudinal section of an organ, the probe marker should be towards patient head, and for taking transverse section of an organ, the probe marker should be towards right side of the body. Now discuss about screen orientation. How to orient a screen during taking longitudinal and transverse section of an organ. During taking longitudinal and transverse section of an organ, anterior and posterior side remain same, but right side, which is for transverse section, is shifted to superior for longitudinal section, and left side for transverse section is shifted to inferior for longitudinal section. Let us do with an example. In this slide, the probe is placed in longitudinal section as the indicator is facing towards patient head. And on image, this side should be anterior side, this side should be posterior side, this side should be superior side, this side should be inferior side. Remember, on longitudinal section, anterior side, posterior side, superior side and inferior side of a organ is visible. This slide shows the organ is cutting transversely as anterior side, posterior side, right side and left side of a organ is visible. Again I am telling, if you are cutting a organ in transverse section, anterior side, posterior side, right side and left side of a organ is visible. That is, on transverse section there is no superior and inferior side, and on longitudinal section there is no right side and left side of an organ. In other words, you can say both in longitudinal and transverse section, anterior and posterior side of an organ is present. But if you are cutting in transverse section, right side and left side of an organ is present. But if you are cutting in longitudinal section, superior side and inferior side of an organ is present. In this way, if you are taking longitudinal and transverse section of an organ, there should be a probe indicator on the screen which is present right side top of the image, which is visible on this slide. Again I am telling, if you are taking longitudinal and transverse section of an organ in this way, there should be a probe indicator on the screen which is present right side top of the screen, which is visible on this slide also. See the probe in transverse section, and there is a probe indicator on the screen which is present right side top of the screen. Now know about correct method of holding the probe. How to hold the probe. First point, hold the probe just like a pen or a pencil. Second point, hold low on transducer. Second point, hold low on transducer. Third point, keep the palm flat against the skin of the patient for maximal contact, which give more control on imaging and better stability. Fourth point, support the scanning arm, that is, rest it on patient body. Fifth point, apply firm and gentle pressure. Not too much of pressure will be applied at examining site. Left side of the slide showing high hold on transducer, which is a incorrect method, but right side is a correct method where low hold and contact with the patient, which gives better stability and good imaging. Again the slide showing correct and incorrect method of holding the transducer. Again the slide showing correct and incorrect method of holding the transducer, where left side is a correct method, where transducer is low hold and palm is in contact with patient body. Again the slide showing correct and incorrect method of holding the transducer. Again the slide showing correct and incorrect method of holding the transducer. See the probe where it is just like a pen or a pencil. Right side of the slide showing correct method of holding the transducer. Hold the probe just like a pen or a pencil. Now discuss about different type of ultrasound probe or ultrasound transducer. Generally 4 type of probe are used. We will discuss it one by one. The slide showing cardiac transducer or phase array transducer. It has small footprints. It is used for cardiac imaging or echocardiography and transcranial ultrasound for neonate. Again I am telling the figure showing cardiac transducer or phase array transducer. It has small footprints. It is used for cardiac imaging and transcranial ultrasound of neonate. This slide showing linear transducer. As name suggests, its one end of the probe is straight, that is linear. It uses higher frequency, that is in between 6 to 15 MHz. It is used for ultrasound examination of peripheral organ, that is superficial organ like thyroid, breast and scrotum, and ultrasound examination of peripheral arterial system and peripheral venous system. This slide showing a convex or curvilinear transducer. As name suggests, one end of the probe is convex or curvilinear. It is more commonly used for abdominal examination or fetal ultrasound. It uses lower frequency. Due to having lower frequency, it has more penetration. It uses the frequency between 2 to 5 MHz. This slide showing a transvaginal and transrectal transducer. It is otherwise called as a endocavitary probe. It uses the frequency between 5 to 11 MHz. It uses higher frequency. That's why it having low penetration. It is otherwise called as a TVTR transducer. As I have already told, frequency and penetration are inversely proportional. When frequency increases, penetration decreases. That's why the probe using higher frequency have low penetration and vice versa. This slide showing 3 transducer where left one is linear, middle one is curvilinear and right one is cardiac transducer. Out of 4 transducer, linear and convex transducer are more commonly used. Cardiac transducer uses frequency in between 1 to 5 MHz and curvilinear transducer uses frequency in between 2 to 5 MHz and linear transducer uses frequency in between 5 to 10 MHz. Now discuss about different type of probe movements during examination. Before going to probe movements, let us know there are 2 type of axes of an probe. One is broad axis, another is narrow axis. Commonly 5 type of probe movements are present. First one is sliding movement, second one is compression movement, third one is tilting movement, fourth one is fanning movement, fifth one is rotating movement. Others are dipping, angling and combining movement. Dipping movement is usually done along narrow axis. Dipping is usually followed by sliding on narrow aspect of probe. When it is used, when we want to view a targeted image in a horizontal plane. Angling movement is usually done on broad axis. Angling always followed by sliding on broad axis. When angling movement is done, it is done to adjust an oblique view to a transverse view for accurate assessment and measurement of a targeted structure. Now come to sliding movement. Sliding is done along narrow axis. Sliding also done along broad axis of the probe. By sliding movement, it brings the target structure to the middle of the screen. During sliding movement, you should keep the probe perpendicular to the abdominal wall and your movement should be slow and steady. You can slide the probe up and down and from right to left, but your probe should be perpendicular to the abdominal wall and your movement should be slow and steady. Again I am telling, sliding can be done in narrow axis, also done along broad axis. Now come to tilting movement. Tilting movement, otherwise called as a rocking movement. It means right and left movement of the probe. When you are cutting a organ longitudinally, you should move the probe right to left, that is tilt the probe right to left to take entire image of the organ. Another movement is fanning movement. Fanning movement means up and down movement of the probe. When you are cutting a organ transversely, you should fan your probe up and down to take entire image of the organ. Another movement is rotating movement. Rotating may be done in clockwise direction or anti-clockwise direction. But you should know what is the orientation of the image on the screen. If you are starting with longitudinal section of an organ, just anti-clockwise movement of the probe, you can take transverse section of the image. If you are starting with transverse section of an image, just clockwise movement of the probe, you can take longitudinal image of an organ. That means rotation movement of the probe is used when we want to view a targeted structure in different plane. At last, there are 5 probe movements: sliding, fanning, tilting, rotating, angling, and at last combining movement. Now discuss about the gel which is used during ultrasound examination. What is its composition, what is its property, and why it is used. Sono-gel is applied to the scan area before contacting the ultrasound probe to the patient body. Again I am telling, Sono-gel is applied to the scan area before contacting the probe to the patient body. But question is, why it is used? Now discuss some features of Sono-gel. It is non-irritant. Second one is, it is non-allergic. It is odorless, non-staining, harmless, having neutral pH, easily removable with tissue paper or towel. And another is, it is water soluble. It composes water, EDTA, carbomer, glycerin and trolamine, propylene glycol, and a colorant, that is a blue dye, for which it is blue in color. The carbomer which is present, it makes gel water soluble. Glycerin and trolamine, it makes gel neutral, colorless, and absorb moisture from air. Propylene glycol, it makes gel non-irritant and helps to retain moisture. At last we will discuss why it is used. First point, it acts as a lubricant. Second point, it prevents bubble formation between the interface of transducer and patient skin. Third one, as I have already told, air is not sono-friendly. Air reflects back all the beam to the transducer. That's why no beam will be present for further imaging. So gel acts as a special acoustic conducting medium for sound wave. Now discuss about different type of body plane or different type of body sections. Generally, three types of planes are present. Out of the three planes, first one is sagittal plane, second one is coronal plane, third one is transverse plane or axial plane. Remember, out of three planes, sagittal and coronal plane coated the organ vertically or longitudinally, but transverse plane or axial plane coated the organ horizontally. Sagittal plane coated the organ or coated the fetus longitudinally. That's why it divides the fetus or divides the organ into right and left half. Another plane is coronal plane. It also coated the organ or coated the fetus longitudinally, but it divides the fetus or divides the organ into anterior half or posterior half. In other words, it divides the fetus or divides the organ into in front and back part. Third one is transverse plane or axial plane. It coated the organ or coated the fetus horizontally. That's why it divides the fetus or divides the organ into superior part or inferior part. In other words, it cut from right to left. This slide showing coronal plane which divides the organ or divides the fetus into anterior half or posterior half. In other words, it divides the fetus into in front or back part. Transverse plane or axial plane divides the fetus into superior part and inferior part. That is, it cut from right to left. Sagittal plane divides the fetus into right half and left half. Now to know how to connect ultrasound probe to port site of ultrasound machine. Entire process should be slow, steady and gentle. Removal of old ultrasound probe from port site and connection of new probe to the port site. Entire process should be slow, gentle and steady. Now see the process, how it is removed and how it is connected. This slide showing the probe is connected to port site of ultrasound machine. That is, old probe is connected to port site of ultrasound machine. I want to remove this probe and connection of a new probe to this port site. First step, you should give anti-clockwise rotation of the knob. Second step, after giving anti-clockwise rotation, probe is taken out from the port site of ultrasound machine. As probe is taken out, port site of ultrasound machine is now empty. Now selection of a new ultrasound probe which is to be fitted to that port site. This slide showing new ultrasound probe is connected to that port site. Now you should give clockwise rotation of the knob and tighten the knob. The entire process should be slow, gentle and steady. Again give clockwise rotation of the knob and tighten the knob. Entire process should be slow, gentle and steady. Otherwise you will be in problem always. Now new probe is connected to port site of ultrasound machine. See the slide how it is connected. Again the same process. old probe is taken out from the port side. Now selection of a new probe which is to be fitted to that port side. New probe is connected to that port side by clockwise rotation of the knob and tighten the knob. Clockwise rotation of the knob and tighten the knob. Clockwise rotation of the knob and tighten the knob. Entire process should be slow, gentle and steady, otherwise you will be in problem always. Now discuss about echogenicity of an organ. There are 4 types of echogenicity. One is hypoechoic, second one is hyperechoic, third one is isoechoic, fourth one is anechoic. By comparing between the two organ or two structure, you can label an organ it is hyperechoic or hypoechoic or isoechoic. Again I am telling, by comparing between the two structures or comparing between the two organ, you can able to know what is the echogenicity of an organ, whether it is hypoechoic, whether it is hyperechoic, whether it is isoechoic, whether it is anechoic. This slide shows hyperechoic means more whitish, more bright in color. Anechoic means more black, more dark in color. In the other word, you can say when you proceed from hyperechoic to anechoic, black color dominates. In reverse, when you proceed from anechoic to hyperechoic, white color dominates. Hypoechoic means grayish or brown in color. Isoechoic means same level of echo between two organ. By comparing between the two structure, you can able to label both organ is isoechoic. This slide again showing when you proceed from anechoic to hyperechoic, white color dominates. One of the example of anechoic is cyst containing pure fluid or gallbladder having pure bile inside. Hypoechoic, one of the example is soft tissue. And for hyperechoic, the examples are bone, air and metal inside. Again I am telling, cyst containing clear fluid or gallbladder having clear bile inside are the example of anechoic. Examples of hypoechoic is soft tissue. Examples for hyperechoic are bone, air and metal. Anechoic means jet black in color, dark in color, no echo inside. Again I am telling, by comparing between the two structures or comparing between the two organ or comparing with surrounding tissue, you can able to label what is the echogenicity of an organ or what is the echogenicity of an lesion. In the slide, left side lesion is isoechoic, as having same level of echo with surrounding tissue. Second lesion is hypoechoic, as having less level of echo on comparing surrounding tissue. It is grayish or brown in color. Third lesion is hyperechoic, as having more level of echo inside on comparing surrounding structures. The lesion is looking bright and whitish in color. Right side lesion is anechoic, as having no echo inside. It is purely jet black or dark in color. Let us do with an example. In this slide, left side top image showing kidney cortex or renal parenchyma is hypoechoic on comparing surrounding liver. Right side top image showing kidney parenchyma or renal parenchyma is isoechoic on comparing surrounding liver. Lower image showing kidney parenchyma or renal parenchyma is hyperechoic, that is looking more bright on comparing surrounding liver. This slide showing renal parenchyma or renal cortex is hypoechoic on comparing surrounding liver. This slide shows a purely anechoic structure which is jet black in color or dark in color, having a echogenic material inside which is marked by an arrow. Let's do with another example. In figure A and D, the lesion is hyperechoic. In figure B, the lesion is isoechoic. In figure E, the lesion is hypoechoic. In figure C, the lesion is anechoic as it is jet black in color. Left side figure shows the fibroid is hypoechoic on comparing surrounding uterine myometrium. Middle figure shows the fibroid is isoechoic on comparing surrounding myometrium. And right side figure shows the fibroid is hyperechoic on comparing surrounding myometrium. Now discuss about posterior enhancement or posterior acoustic enhancement. What is the main funda behind it? Let us discuss. As I have already told, the strength of the ultrasound beam and frequency of the ultrasound beam gradually decreases as it goes more deeper. Suppose strength of the ultrasound beam or pulse of the ultrasound beam at the level of probe, that is at the level of near field, is 100% and just above the level of cyst it is 60% due to gradual beam attenuation. Due to presence of cyst containing clear fluid inside, beam attenuation is much less comparison to other surrounding area due to solid in nature. Due to less beam attenuation, the area just posterior to cyst having more strength of ultrasound beam, more strength of frequency is present, which is more scannable than the surrounding areas. Due to presence of cyst, this area have less beam attenuation, so the area just posterior to it have more resolution, more echo. It looks more brighter than the surrounding area. This is enhancement. This is posterior enhancement. So we can say if cyst containing clear fluid inside, there must have posterior enhancement. In the other word, we can say if posterior enhancement is seen, there must be presence of cyst containing clear fluid just anterior to it or just above it. Let's discuss with an example. It is cyst containing clear fluid inside as it is anechoic and purely jet black in color. And the area just posterior to it have enhancement, that is posterior enhancement due to less beam attenuation, which is due to more scannable area having more level of echo, more resolution, which looks more bright than the surrounding areas. This slide showing a cyst containing clear fluid inside as it is purely anechoic and purely jet black in color, and the area just posterior to it have posterior enhancement or posterior acoustic enhancement due to less beam attenuation. The area just posterior to the cyst have more scannable, more resolution, more level of echoes, for which it is more bright than the surrounding area. It is posterior enhancement. You can say if there is posterior enhancement is present, there must be a cyst containing clear fluid just above it. In the other word, you can say if there is cyst containing clear fluid present, there must be posterior enhancement just posterior to it. Now discuss about posterior acoustic shadow. The area where 100% beam are reflected back to the transducer, that area appear as a highly echogenic, and this area produce posterior acoustic shadow. Shadow area is non-scannable, non-resolved part. Let's do with an example. Left side image showing anechoic and jet black in color and having posterior acoustic enhancement due to less beam attenuation, and the enhancement area is highly scannable, more resolution part, more echo present, that's why bright in color. You can say if there is posterior acoustic enhancement is present, there must be a clear fluid just above it or anterior to it. And in reverse, you can say if there is anechoic or jet black area is present, the area posterior to it must have enhancement. The right side figure showing posterior acoustic shadow is 100% beam are reflected back to the transducer, and the area just posterior to it produce a shadow as the area is non-scannable, non-resolved part. This slide showing a anechoic area as it is purely jet black in color and having posterior enhancement, and inside the anechoic area there is a echogenic material present which produced posterior acoustic shadow. The shadow area is non-scannable, non-resolved part. This figure is urinary bladder having stone inside. This slide shows gallbladder in longitudinal section and having a echogenic structure inside, which is a stone itself, which produced posterior acoustic shadow. This area showing gallbladder having transverse section, having a stone inside, which is a echogenic material, having posterior acoustic shadow. I have already discussed about echogenicity. Now discuss about echo texture, which is divided into homo and heterogeneous echo texture. Homogeneous echo texture, otherwise called as a fine echo texture, and heterogeneous echo texture, otherwise called as a coarse echo texture. Homogeneous echo texture means same level of echo throughout an organ. That means same level of echo from top to bottom of an organ. Heterogeneous echo texture means different level of echo throughout an organ. Let's do with an example. This slide shows ultrasound image of a testis where it is homogeneous echo texture is same level of echo throughout the testis. This slide shows heterogeneous echo texture of testis as different level of echo throughout an organ. This slide shows homogeneous echo texture of liver and heterogeneous echo texture of liver. Upper two images showing homogeneous echo texture of testis as having same level of echo throughout. Lower two images showing different level of echo throughout. That's why it is heterogeneous or coarse echo texture. Thank you. Thanks for watching.